Welcome. My name is Peter Kamau Musheru, a speech and language pathologist or therapist, as we are famously known here in Kenya. I've been practicing as a speech and language therapist for the last 5 years, dealing mainly with children with diverse communication disorders. And today, I'll be your guest at Meet the HR show. Welcome.
Thank you for having us.
You're welcome.
How are you today?
I'm good.
Pleasure. To start us off, I'd like you to break for us and help us understand who is a speech pathologist.
Thank you. A speech pathologist is a specialist in communication.
All right.
When we talk of communication, we mean these are people who, the way we communicate, pass and receive information on a daily basis, sometimes it's impaired. So what the speech and language pathologist or a speech language therapist do is to rehabilitate the communication disorders. If you identified you have a communication disorders, then the work of the speech and language therapist, they come in to rehabilitate that, either by treatment or modifying a few things here and there for you to be able to pass and receive information on a daily basis.
All right. There's a difference between speech pathologist and speech therapist, or it's the same?
There is no much difference. I think, I guess that in different countries we call it differently. Okay. It's like just like when you go to this country, they talk of wardrobe. When you go to the other one they talk of, there is a different name, they call the same thing. So I don't think there is much difference. It's one and the same thing. Yes. And here in Kenya, we are trained as speech language pathologists, but outside here, we are called speech and language therapists. Okay. Yes.
Speech and language therapists.
Yes.
In our earlier discussion, you had told us you're about 20 in the whole country.
Sure.
Is this not a common course, or what's not happening?
I think it is really growing. We can say in the recent years, yes, we adding into the number. Before we went for training, I think they were even few. Okay. They were less than 10 in the country. But we thank God that now there is some trainings in the country, and we happen to be the pioneers, yes, to be trained right here in Kenya. So I know there are quite a number of students. If I go to my student portal, I'll understand that there are more than 40 students now. Right. In the near future, the crisis will go down.
Okay.
Yes.
And who do you deal with? Is it adults? Is it children? Is there a certain age that you deal with?
As a speech language therapist or pathologist, we are trained to deal with both parents and pediatrics. Pediatrics means these are children and adults with communication disorders. Right. Like adults, there are cases of people who lose their speech at old age due to other causes. It could be accidents, stroke, it could be just you wake up tomorrow and you're not talking, the abuse of our vocal cords and such. Yes. So those are some of the adults that we treat. But again, there are children who makes a big workload for me. I mainly major with children with diverse communication disorders.
All right.
Yes.
Tell us about the interesting story about your journey.
Into this.
Yes.
Yes. I think it's been quite a long journey, but it is a worth walking journey. Right. It has not been an easy one. Yes, bearing in mind, as I told you before we started training, there were less than even 7. I think there were 7 speech language therapists in Kenya when we were starting. Yes. Yes, so it has not been an easy journey. Even for Kenya to come to where we are today that we are training, it has been a journey. Yes. If I surprise you, we only have 2 lecturers who can train in the university level.
How comes?
Yes, we only have 2 currently.
Yes.
Yes, and they are found in Kenyatta University and they are doing a good job. All Dr. Right. Kari and Dr. Abuom. Yes. Yes, so it has been a journey. For me, it was something that I wanted to do. Having worked in the world of special needs, okay, I realized that many other conditions, they got interventions. Yes. But when we come to communication disorders, it didn't get much attention. So I felt that there was a gap. So I decided that this is the course I want to do. And when I thought of doing my master's degree, when I went checking, the first thing I found, PAP, it was speech and language pathology training in Kenya. And I think we formed the first group that joined the course in this country, yes.
And is there an undergraduate course that you pursued that enabled you now to do your master's in pathology?
I didn't pursue an undergraduate course that led me into that, but I did pursue a course in education.
Okay.
Once a teacher, always a teacher. A teacher can become anything. Yes. I know of many teachers who are pathologists. I know many teachers who are journalists today, who are comedian and who act. So a teacher can become anything. Yeah. And when I did my education, I needed it to land me into something that was far much away from education. Yeah. And I think this was a good thing that I fell in. Yes. So I did degree in special needs education, Kiswahili and CRE. So I'm a high school teacher, but with much emphasis on the special needs. So and my degree was in special needs education.
You practiced it?
Yes, a lot.
For how long?
During my old days, when I was still in school, I was working. Yes. So I did it as a school-based, that is part-time education. But during the school calendars, I was still working and practicing. That's when I was able to interact with all the conditions. Yeah.
Oh, all right. And now you did your master's.
Yes.
How was it for you?
It wasn't easy.
Yeah.
It was very difficult. In fact, when I applied for my master's, the very morning my daughter was born. That morning when I was busy registering, my wife was in the labor ward.
You're in school.
Yes, me, I'm in school.
Yes.
So it wasn't an easy journey, but it was very interesting. Right. In terms of learning, it was very good. Okay. The challenge became, number one, when we wanted internship. Having 7 speech language therapists in Kenya, we only had one place we could go for internship. That was in Gertrude's Children's Hospital in Muthaiga.
Now all of you crowding that same place.
So we had to all crowd there, but different times, because you have to acquire 364 hours, active hours, into speech and language, either observing, just sitting in a room to observe and look at the speech language therapist doing. I think it was like 60 hours. Then I started working. Then I need to go and see an audiologist. An audiologist is a specialist who deals with hearing, test the hearing, until we finished the 364 hours. Yes. Then after that, we had the whole journey of writing our thesis. Thank God we have one here. I have my document, it's right here. Ah. Yes, at least we were able to do that. Yes. So it wasn't easy, but I will say that it was a noble cause. All right. Yes.
Did you start practicing immediately, or it took some time after the internship?
We even started before, because the need is there.
Oh.
Yes, I think I've seen so many children when I was training. I saw so many who are already, some of them are now speaking. We just held the, what do you call it, the bull by the horns as early as that. Yes. But when now we got the license, we graduated, now I got into practice completely.
Okay. Yeah. So there's a licensing factor.
There is, but in Kenya we still have a long way to go. Yeah. Like now I was checking, we are working out to be regulated by the Kenya Health Profession, I think, Authority. Yes. So we are in that process of registration. So it's a free field for now, though we are heading there slowly. Yes, because as we stand, we are not even recognized by the government.
Not even, you know, when someone hears the word pathologist, they feel like this is a doctor, Dr. So-and-so. Is it inclined to that direction, or you're just a teacher and now sometimes you're in the shoes of a doctor?
No, I think it depends with the environment I'm working in.
All right.
There are somewhere I'll go, when, like now you've come, this is a school setup, it's our school. So I found it working best for me when I'm doing intervention, because some of these children, this is a natural habitat. So we have regular and children with special needs. So they get that inclusion, the time to be included with others who are regulars. So if I'm working within a school setup, children call me teacher.
Yeah.
The clients who come in, they call me teacher.
Yes.
If they are referred from a doctor, a medical doctor, they'll come and call me doctor.
Yes.
If I'm working in a clinical setup, then I'll be a doctor.
Yes.
If I'm working within a home setup, then I become Uncle Peter. So,
True.
but the ultimate goal, what do you want to achieve? And I see children achieve on all the environments. Yeah, depending, the name doesn't matter. Either you call me a doctor, some I just tell, please call me by my name. Yes.
Kindly.
Yes.
And now for an individual who wants to pursue such a course, should they start with being a special needs teacher and then graduate and do their masters in now the speech pathologist, or there's a certain course they can study from, let's say, certificate, diploma, then now the graduate master's level?
In Kenya, we have no many options currently. We have no many options, but thank goodness there is such a course, I think, at higher diploma at KMTC. It has started in Kenya. I think you go through the normal registration of, I don't know what are their grades at the KMTC for you to be taken to take a course there.
Yes.
So you go through the normal registration. Then University of Nairobi, they have been in a mission to do the degree course.
Yes.
So students will be admitted just like any other course. So you'll find that they will land into that. Some will be chosen to do speech and language. But as we stand today, we only have it at master's level at Kenyatta University. And I still go back to what my lecturer, I was talking to him the other day. He said that the aim of this one was to develop the trainers.
Oh.
So that's why they started
Okay.
at the master's level.
Okay.
Because, you know, the same course at a degree level, you'll have many students. And as I told you, we only have 2 lecturers.
Hey.
So
So there's a challenge there and a
challenge.
job niche.
Yes, there is.
All right.
Yeah, but currently I think I know of one speech language therapist doing her PhD. Yes, so I think we'll have like 3 teachers.
We're increasing the
We're
numbers.
increasing the numbers, yeah.
And for such a career, someone may be inclined to getting in it because of a personal experience or a certain interaction. You being a special needs teacher, was it the one that curated you to now become a speech pathologist?
Yes, I think when I was dealing with children in special needs, I think I really saw that need. There was a great need. Number one, even of special needs. The special needs educators are not enough in this country. Number two, they are not regarded with their due respect that they need to. For instance, when they are the Kenya National, what do we call it, the TSC, Teacher Service Commission they are employing, they don't consider that aspect of special need. I support so many schools. I do consultation in different schools in this country. And when we are doing this, you realize that teachers, the regular classroom teachers, they need support. Yes, so I put away my therapy thing and now I get into teaching, so that we're able to support these same children that we see in the clinics and in schools and all over, even at their homes, they learn at schools. Okay, so you realize that in a school setup, we really need to support that. So for me, it was out of that. We have children whom were regarded as stupid. They could not communicate, they could not do what. And in Africa and Kenya, they are regarded as outcasts. So we really needed to come in strong so as to be able to support the communication part. Because the rest of the things, at least if it is physical, there is a lot of occupation therapy. Education, there is education, speech, there is special needs education. And if they are sick, they go to the hospital. But when they land even in the hospital, they find a doctor who has no idea that a communication disorder is there. So they tell them, just go home, mtoto ataongea.
Relax too, mpe to time.
Yes, yes.
And now, you started an internship in Gertrude's Hospital.
Yes.
Then you elevated, right now you're in a school setup. So after graduation, where are the opportunities? Opportunities
are all over.
Okay.
Yes, like you realize with the lifestyle that we are living and then the society that we are in, I think the highest caseload that I'm seeing today is of children with delayed speech.
Yes.
Who catch up with with time. So you realize that the opportunities are even next to us now. Yes, like now we are in a school setup here. I can tell you for free, we are about 40 to 50 children, half are special needs with communication disorders and half are regular children. Yes, so the opportunities, you realize that all these children are from within our localities. So you can either go for a school setup, it's not inferior. So many of us wants to go to the, me, I don't want to go to a school, I look like a teacher. And for sure, that's where the need is. And that's where we get the results like, very fast. Other than now, the same child will come see me. I see them here as well. From home, they come, I see them for 40 minutes, they pay, they go home. But I won't get results as fast as when that child is within a school setup. Yes.
It's very different wakiwa home and now in the school.
Exactly.
And now, a child and a parent have approached you and they feel like the child has a speech disorder. Could you paint for us a picture of how you would deal in such a scenario?
Sure. I think the first thing that we really look at is if we can be able to prevent.
Oh,
yes.
There is the preventive one.
Yes. If we can be able to prevent the occurrence of a communication disorder, that becomes the best for us. We say that prevention is better than cure. To treat it takes, it's very expensive. It's a tedious journey. Because you see that a session might go for 40 minutes. I want to see a child for 40 minutes, twice per week or thrice. And each session, for instance, will cost anything between 2,000 and 5,000 in Kenya.
40 minutes.
40 minutes.
Yes.
So it's a tedious journey. The parent on that day, they don't go to work because they must bring them. So you realize that many parents of children with communication disorders are full-time parents. They even leave their jobs just to bring the children for. So if we can be able to prevent, and some of the simple things that I tell my parents and my friends are something as, I know you are in media, something as small as too much screen time. Please limit the number of hours or even do away with the screens in your house. Now there is a lot of craziness about the cartoons and all that. Then the child starts to acquire the first language that comes because we didn't interact with our child. The first language that comes about is a cartoon language. So now I'll need to come and detox, then I input.
Now, now take me through the process. You've gotten the parent and the child is now, I won't mention the cartoons, but we know the music that plays behind the music. The cartoons. Now, how do you detoxify?
So we start the whole journey. Number one, we do the assessment. Upon arrival, we need to do, we call it an initial consultation. We do the assessment with the child just to go through the journey since birth to where the child is. So the age is very important to us. I'll look at the child's age and at what age is the child supposed to have acquired what. So if it is a 2 years old, there is the milestones they need to have acquired. If it is a 5 years old, there is what they need to have acquired. So we identify, then we look at the gaps. Where did we miss where did we miss it? So then we go back to that level. So if sometimes it will call us to modify the environment, sometimes to change a few things here and there, then the child is called to come in for treatment. After assessment, we do the diagnosis. After the diagnosis, we make a plan. After a plan, we start intervening by working out the plan, which sometimes work, sometimes it doesn't. It depends.
The it doesn't work part is the one parents don't want to hear.
They don't want to hear, but that's the reality. Because if I'm telling you what we are doing here, you transfer it to the home and you don't do it, then it might even happen, but it will take a bit of time. Other than when we are working collaboratively. The other bit is that we need to do a lot of family therapy. The family therapy, like it's not one family that has come here, I call the entire family. And I tell them there is a need for us to work on this. So that when they are home, they are doing the same thing when I'm here. Because I'll see the child for 1 hour, then you have the child for 7 days, 24 hours, minus 1 hour that I saw the child. So the much of it is done at other environments or in a school setup more than in a therapy room.
This career doesn't need a lot of convincing power. It is your work that speaks for you.
Sure.
How do you tell people that I know what I've been doing? I know we are very few, but
Yeah.
trust me on this.
Yes.
Yes.
I don't even look for any. They come. They look for me.
Yes.
They call us because the need is already there. They are sent to us by their referrals. Yes. Mainly we work on referrals. I've worked with a child who has done so well. Then they are told, go and see so and so.
Yeah.
Yes. Like you see me, I'm a freelance. I'm a private practice. So I don't go. For those who are in the hospital setup, they will come. As they come for other treatments, then they will, by either default, they land into that clinic. But some of us, like me, who is in private practice, most 100% of my clients are referrals.
All
Yes,
right.
they refer each other to me.
Okay.
Yes.
And now for grown-ups who are having the speech disorders and the speech problems.
Yes.
It's very different how you'll handle a child and an adult. How would you go about it?
I'm not one very good person in adults, so but I really see them because the need is there. In our training, we did about children and adults.
Okay.
Yes, so I'm trained to do both.
Yeah.
But you need also to do the specialization. The specialization bit helps us now to, you take a niche. You know, there is what you say, there is a niche
Yes.
where you do best. So I do best in children. So when we do the adults, it's still the same process.
Yes.
We need to know what was the adult doing and what, number one, what is the main cause of the communication default or communication disorder.
Yes.
You've had the cases of stroke.
Oh, yes.
The stroke cases will land mostly when the stroke happens, the brain, in the part of the brain that deals with language, is affected.
Yeah.
Yeah, we say the left side of the brain. Then mainly the client will have what we call aphasia or dysarthria. So
You've
those
started the term.
I don't want to go to that direction. Aphasia is just that they lose the language that they were using. You could be here talking to me. You are talking too much, but you are not connecting the
dots.
We are discussing this story, then another one is coming in, then another, but we cannot connect.
Yeah.
Others will just go, they cannot even be able to speak at all. Others, they want to say something, but it cannot come out. Okay, but exactly they know what they want to say.
Yeah.
So there is dysarthria, there is apraxia. Apraxia is the coordination of the brain. The brain cannot coordinate to say exactly what you say.
Yeah.
Mainly in clients with stroke, you'll find the two condition, apraxia of speech and aphasia.
Yeah.
And aphasia they are subdivided into other things. The other ones, they cannot even be able to move the muscles.
Okay.
The speech, we call the articulators, they cannot be able to move them to say what they want.
Yeah.
For instance, for this one you can find in children or adults with cerebral palsy. Okay, so all these conditions, by the end of the day, as an adult, we'll do an assessment.
Yeah.
And why you want to rehabilitate your speech, because this much of rehabilitation. Do you want to go back to work? Like now you are a journalist. If you lose your speech, what will happen?
I will need to go back to work, so I need the rehabilitation
You need the
process.
And it is not an easy task. Sometimes as adult, you have your own judgment. Everything is, why am I telling you to say apple, and yet you have been saying
All this
all
time.
these things? So it is in adults, unless they are very committed into this, they get frustrated easily. Yes. So that's why you need to go the family therapy, so that the family can be the support system.
Yeah.
Yes. So we do the assessment again. We make a plan. We check on where the client wants to go.
Yeah.
Then we start the journey of treatment.
And now, we might say that things are evolving over time.
Yes.
So does it mean that you have regular trainings, regular seminars, or the one that you studied in school is the one we go with till the end?
No. There is what we call CPDs, Continuous Professional Development.
Okay.
In our association, I'm a member of that committee. Currently, I'm in one with ITLP. I won't give you the full names. ITLP.
Yes.
It's an international organization where I'm in mentorship. So I have mentors all over the world,
Yes.
so that by the end of the day, you are able to develop yourself. So we are encouraged to do the CPDs because you realize that what you learned in school, but most of these things are not even applicable when you come to the field. So you need people who will be taking a case by case. If I find a very difficult case today, I have the contact persons. I just need to discuss with my superiors and my seniors, both outside and inside the country, and I'll get there. And the people are willing to help. So we should not bury ourselves and say, oh, I've trained, I'm good to go. Nobody is good to go. So we have to go through the whole process of CPD, continuous professional development on daily basis. Even as you were coming, I was reading.
Ah.
Yeah, you need to read like no one's business.
So the training does not end.
It does not end.
All right.
You are given the basics
Yeah.
and the structures on how to go about it, but you need to keep on. Sometimes we book, I go to the hospitals. I just book and sit back on other professionals, like on audiologists. I just watch what they are doing because the people with hearing and communication, hearing disorders, they will come to me. I need to interpret the audiogram.
Yeah.
Yes. I need to discuss with them which is the best way to treat this case.
Yes.
Like he's asking about a sound. Where does it appear in an audiogram? So that I can discuss such issues with my other professionals. It's a multidisciplinary approach, yes.
You've dealt with very many cases.
Yes.
How do you term a case to be successful?
It's that I cannot show you here, but I have one right in this room, a very successful case of a child. The parent came to see us. She really cried in this office. I told her, finish, then we shall start dealing with it.
Yeah.
But as we speak today, the child is doing very well in grade 2, speech fluent, learning good, everything perfect.
Yes. Looking at this camera,
Yes.
I'd like you to tell an individual who is planning to take such a course. Should they get into it or look for another career?
We need as many as possible. Please come through. We are here to support you. It's a good journey. It's an interesting journey. It's an area that you need to pursue. I know we have not many options in Kenya currently, but they are opening up. Please look forward, look at Kenyatta University, what they are doing. If you've already done a degree, don't care what you did. Just walk in and ask them what you can be able to do. Go to Nairobi University, know how far they have gone with the degree course. Then go to KMTC Nairobi, just find out how far the course is. But it's a good, interesting. But one thing I want to warn us, it's not about money, it's about the passion. So if you don't have passion into this, please don't come. But if you have a passion, we say it's not a profession, it's a calling. So if you are called to come, who are we to tell you not to come?
Welcome.
Please come. Yeah.
Thank you for having us today.
You're welcome.
And we wish you the very best. And now we hope the next time we are coming back, we'll find someone who's a lecturer somewhere.
Exactly. I think that one is underway. I'm filling in the papers here and there. I really need to do that.
Yes.
There is a need for us to develop many of those so that we can be able to train.
Thank you very much.
You're welcome.
This has been Meet the HR Show with me, Laura Nell. Until next time, bye.
Bye-bye.